I'm here at GBR Plastic Surgery located in the Hilltop area of Virginia Beach, and I needed to get some testosterone tests run, and let's go check out the results. All right, so Dr. Eric, man, good to see you.
Good to see you, Quincy.
First time seeing you, right?
Yeah,
Face to face.
Absolutely.
So obviously we're here about checking the testosterone levels of myself. But I got to ask, like, what are the signs of low testosterone, and actually, like, how low is too low?
Yeah, good question, Quincy. So it varies, I guess, is the easy answer. There are a lot of things that guys can experience that can be attributed to low testosterone. So a number of these are fatigue, low energy, low libido, erectile dysfunction.
Gotcha. So medically, like, why is it important to get checked?
Yeah, so a man with a low testosterone is not going to feel themselves. So why is it medically necessary? Well, it gives you more energy to do what you need to do, okay? It helps with the, like we talked about before, libido. So, helps your relationships, right? We've seen relationships fall apart because of that very reason. It helps with your cardiovascular health. If you have more energy to do things, you're gonna have more energy to go to the gym or go for a run.
Makes sense.
And that obviously is good for your heart.
All right, well, you know what? I know that I got my blood drawn a couple of days ago, and they say it takes about 2 to 3 days to get the results back. And we're on that third day, bro.
Yeah. So I do have your results right here, but before we talk about that, you asked the other question, how low is too low?
Yes.
Right?
Yes.
According to our governing body, which is the American Urologic Association, we consider low to be anything under a total of 300 nanograms per deciliter of total testosterone.
Gotcha.
Okay? So I use that as a segue into yours.
Okay.
All right? So your total testosterone on this panel was 371.
Is that good?
371. So by definition, you don't have low testosterone. You're within the normal range, if you want to call it that. Now, you are on the low end of the normal range at 371. Okay, so what I would recommend, if you were my patient, is let's get another panel, maybe in another 3 months or so.
Okay, so then let's jump to, let's say my levels were at the lowest where now treatment needs to be administered.
Right.
So what are the benefits of pro pellets versus the other forms of treatment?
So there, hormone replacement therapy or testosterone replacement therapy, whatever you want to call it, comes in many different forms. Okay. But one of these things, as you mentioned, is the pellets. Okay. Yes. And what these pellets are is a slow release testosterone. Okay. So what we do is we implant a number of pellets underneath of your skin, usually in the hip area. But it can be done in other places as well. And then over the course of about 4 to 6 months, that testosterone is going to do the work for you, do the work that your body's going to do, that your body needs it to do. Yeah.
You were saying that you put them, like, they're up under your skin. Right. So what's the procedure? Because that sounds a little weird.
I usually use it like the hip area because it's a pretty large surface area. After you numb the area up with some lidocaine, you make a small little incision, less than 1 centimeter. Okay. And then the medication comes with a kind of like an applicator almost.
Okay, so no one needs to go under. Like,
no. This is all
anesthesia.
Correct. This is all under local anesthesia.
Okay, so just don't look at it because you may.
Yeah, if you. That's right. So then with the applicator, I just simply place the pellets underneath of the skin, kind of away from that incision, so that they don't migrate back out. And then once all the pellets are in, one little stitch that's absorbable suture, so you don't have to get the suture taken out, and that's it.
So, Dr. Eric, question that I would have, and I'm sure some of the viewers may have too, me as a black male, like, is there a difference when it comes to, like, race, or, like, is there any statistics that prove that, or is it just men in general?
So not really, Quincy. I think it's just men in general, and as we get older, each decade of life, our total testosterone does predictably decrease over time, and so and that's really across the board. I don't think there are any studies that show race has anything to do with that particular thing.
Okay, gotcha. All right, so I'm somewhat healthy. Thanks for giving me these results.
Of course, Quincy. Yeah, my pleasure. My pleasure.
No, I'm gonna keep that.
Oh, you can keep it. All right, good. Yeah, you got
it. Hey guys, results are in. It looks like GBR Plastic Surgery is the place to go for everything men's health and wellness.